Good afternoon, Nico Hidefield. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. I'm Hayden Marcus, one of the nurses here on the ward. I can see you look quite worried right now.
Yes, I am nurse. The doctor mentioned something about an abdominal tap and taking fluid out of my stomach. It sounds terrifying. Is that what we are doing today?
I completely understand your anxiety, Mihiraa. It's perfectly natural to feel this way when facing a procedure. I want to assure you that you're in good hands. Yes, we are here to talk about the procedure called an abdominal tap or paracentesis, which has been scheduled for you. Before we go into the details, how are you feeling overall right now?
I feel very full, and the tightness in my stomach makes it hard to breathe deeply sometimes. My belly is huge, and honestly, the thought of a needle going into my abdomen is making me very nervous.
Thank you for sharing that with me, Mihiraa. It sounds like you're experiencing quite a bit of discomfort from the fluid buildup, and your worry about the procedure itself is very real. The purpose of this procedure is actually to help with exactly those symptoms you described. We call this fluid buildup ascites. The abdominal tap is necessary for a few main reasons. It helps with diagnosis. By analyzing the fluid, doctors can figure out why the fluid is building up in the first place. More immediately, it's also therapeutic, meaning it's a form of treatment. Removing some of that fluid can relieve symptoms like the breathing difficulty, the pain, and the bloating you've been feeling, helping you feel much more comfortable. I want to reassure you that this is a common, simple procedure that we often do right here at the bedside, and it's not considered serious surgery. Does knowing the reasons for the tap help you understand why we're doing it today?
I suppose that makes sense, especially if it helps my breathing. But how exactly are you going to do it? It sounds very invasive.
That's a great question, Mihiraa. Let me walk you through the procedural steps so you know exactly what to expect. First, we will get you into the correct positioning, usually semi-upright in the bed. This allows the fluid to collect in the lower abdomen. We will then clean the skin thoroughly where the tap will happen, making sure it's completely sterile. After that, the doctor will administer a local anesthetic with a small injection to numb the area, so you should only feel a sting at that point. Once the area is numb, a fine needle or a special catheter will be inserted to slowly drain the fluid into a collection bag. This part is relatively quick. Once enough fluid has been removed, the needle or catheter is removed. Do you have any questions about these steps before I discuss what you need to do to prepare?
No, that was clear. What do I need to do before and after?
Excellent. There are a few important things regarding pre-procedure and post-procedure care. For the pre-procedure care, the most crucial thing is that you need to empty your bladder beforehand. This prevents any accidental injury to your bladder during the tap. During and after the procedure, we will monitor your vital signs like your blood pressure and heart rate, and also closely monitor the fluid drainage. As for post-procedure care, as soon as the needle is removed, we will apply pressure to the puncture site to help it seal, and a small dressing will be applied. It is also important that you lie on the undrained side for 1 hour after the procedure. For example, if the fluid was drained from the left side, we would ask you to lie on your right side. This helps the side heal properly and minimizes the risk of leakage. Do the pre- and post-care instructions make sense?
They do. Thank you. But what about the pain? I am still scared of what the result would be. Will it hurt?
That's understandable, Mihiraa. Many patients share the same concerns about discomfort and results. First, regarding the results, I know you are anxious to find out what the fluid analysis shows. However, I must explain that it is not my role to give you specific results right now. The fluid sample needs to be sent to the lab for detailed analysis, and that takes time. Once the results are back, the doctor will consult with you personally to discuss what they mean for your health and treatment plan. We appreciate your patience while we wait for that crucial information. Now, let's talk about the pain and discomfort because we want to make this as comfortable as possible for you. We take several steps to manage your anxiety and discomfort. We want to ensure your comfort throughout the entire process. The procedure itself is relatively quick. To address the pain, the doctor will use a local anesthetic to numb the area, which means you should only feel a sharp sting when the numbing injection is given. After that, you might feel a sensation of pressure or pushing, but it should not be painful. If you start to feel lightheaded or uncomfortable at any point, please let us know immediately. Sometimes focusing on slow, deep breathing helps to relax your muscles and ease any tension during the tap. Do you have any other concerns or questions about your comfort or anything else before we proceed?
That makes me feel a little better about the pain. I know I have to wait for the results. But if there's a needle involved, are there any serious risks? I keep imagining things going wrong.
That's a very important question, Mihiraa, and I appreciate you asking it. It is always best to be informed. Every procedure carries some inherent possibilities, and I need to advise you of the potential risks or complications associated with an abdominal tap. While we consider this a very safe procedure, potential issues can include minor things like a bit of leakage from the puncture site after the needle is removed, a small risk of infection, or some minor bleeding at the site. More rarely, there is a slight risk of damage to the bowel or bladder if they are nearby, or a temporary change in your blood pressure as the fluid is drained. Please be assured, we take very specific steps to minimize these risks. For instance, the doctor will often use ultrasound guidance before and during the procedure. This allows them to clearly see your organs and select the best, safest spot for the needle, which significantly reduces the risk of damaging the bowel or bladder. We also use proper sterile technique, making sure the area is completely clean and using sterile equipment to prevent the risk of infection. We will also monitor your vital signs closely throughout to manage any potential change in blood pressure. Do you have any further questions about these risks or how we work to keep you safe?
I think I feel a little better knowing they use ultrasound and that I won't feel much pain. It still sounds a little scary, but I trust you.
Do you have any final questions or concerns about what we have discussed?
No, I don't have any more questions.
And based on this explanation, do you give your consent for us to proceed with the abdominal tap?
Yes, I give my consent. Please go ahead.
That is good to hear, Mihiraa. I know it's a lot of information to take in. To make sure everything is clear, let me quickly summarize our discussion one last time. We are performing the abdominal tap to both diagnose the reason for your fluid buildup and to relieve your symptoms, like shortness of breath. You will be sitting semi-upright, and the area will be numbed with local anesthetic before a fine needle is inserted to drain the fluid. Before the procedure, you must empty your bladder. Afterward, we'll apply pressure, and you'll lie on the undrained side for an hour. We'll be monitoring you closely throughout. We will get everything ready now. We'll be right here with you every step of the way. If you think of anything at all, please feel free to talk.